Okay.
Yeah, so with Stevens-Johnson's syndrome, it's a severe form of allergy where you get what they call desquamation, so the skin sloughs off.
Yeah.
When you get it, it's from a number of different medications. Theoretically, the most common one is something called Septra, which is an antibiotic that, from what I can tell, you haven't had recently.
Do you know which antibiotic I'm on right now?
Right now you are on...
It started with a T, maybe?
Ertapenem. Now you're on ertapenem.
Okay.
Yeah. You've had a number of antibiotics since you came in.
Right.
We don't routinely use the Septra, like sulfate drugs like that.
Yeah.
And when you get Stevens-Johnson syndrome, you tend to get it in lots
Everywhere.
of places.
Yeah.
It's not typically isolated just to one leg.
That's what I heard too.
You can get desquamation from inflammation as well, like general inflammation, like from a bad infection.
Yeah.
And I think that's what this is that you had a bad infection, severe infection, and we know from your blood cultures that you have an infection.
Yeah.
And this looks like a severe cellulitis that's now improving.
Okay.
There are a few things that I want to check before we make a final plan for the antibiotics. One is, I think it would be helpful to try to ultrasound that ankle to see if there's fluid in the joint.
Okay. That's what it feels like. It hurts.
If you have, yeah, right.
And the knee too. What about the back?
Knee,
Should I get?
I don't think there's fluid in the knee at all.
Should I get X-rays on my back? I think I need to get that checked out.
So I also want an MRI of the spine.
Yeah.
Because there's been a change in the past few weeks that coincides with you developing a bloodstream infection.
Dr. Ali wanted to order somebody. He knew I was in too much pain to go do the X-ray and scans, so he said he'd leave it for a day or two.
Yeah. So in this case, I want an MRI specifically. We don't have an MRI machine in this hospital, so they'll transfer you to Niagara Falls to get it done and then bring you back.
Okay.
So ultrasound of the ankle, MRI of the spine. If there's fluid in that ankle, I want them to draw it off, and then we'll see what the spine shows. The echo that you had done didn't get great pictures because you weren't able to move that well.
Right.
And you have pain. You weren't able to get in the position they wanted.
Right. Yeah.
So I have that in the back of my mind that if we determine that you've got something like a joint infection in the ankle, or if we find something in the spine that suggests there's an infection in the spine, then I think we need to reassess for the possibility of a heart valve infection.
Okay.
The bacteria that grew in your blood is not a super common cause of heart valve infections, but it can cause heart valve infections. And if we find these kind of multiple sites of infection, then I think we really need to consider it, in which case you may not be able to get the transthoracic echo done, where they go over the chest wall.
Okay.
We may not be able to do that just because you're in pain and you can't get into the right positions. So we may end up requesting a transesophageal echo, which you've had endoscopy before, I assume.
Yeah.
It's basically this endoscopy, but instead of a camera, they have an ultrasound probe. So they go down the throat, just to the esophagus, and they use the ultrasound probe to look at the heart valves.
I think I've had one of those in the past too.
It's possible. I'm not sure.
Might have been this summer, yeah.
Yeah, but I think, if we see multiple places where you have infection, then I think we need to consider better heart imaging than we have. Okay, so that would be the transesophageal echo. But I want to get the MRI and the ultrasound done first. If the back just looks like fractures that we know you have, and the ankle shows soft tissue swelling, right, that goes along with cellulitis, then I wouldn't want to pursue the heart valve infection any further because it's really not a likely diagnosis.
So what do I do about the back? Just pain management and rest?
Pain management,
Skyrizi.
Yeah.
Because the reason why Dr. Tarek is switching me to Skyrizi, she said I'd be less prone to infection and it works a lot better on the bones.
Yeah, so they might be able to get you off the steroids.
Right. We're trying to do another taper right now. We're doing 1 milligram every 2 weeks.
Yeah.
As tolerated.
Yeah.
So I got down to 20 milligrams, but then Dr. Ali said, let's just go back up to 25 so you don't get any sicker than you are now. We'll leave it like that until that, and then we'll continue with the taper once this is all figured out.
That's right. When you have an illness of some sort, your body needs more steroid.
Yeah, and the nurses at night, they wouldn't believe me. They wouldn't give me my prednisone. I said I had 15 milligrams this morning. I need another 10. And she said, no, that's not on our sheet. We can't do that. I said, it is though. I talked to Dr. Ali. He said, we're going back to that. And if I crash, my organs are gonna I'm gonna get really sick, and she couldn't believe me. And he said I could go off on my pain medication. They wouldn't believe me on that either.
For the antibiotic, the plan is going to be a minimum of 2 weeks of the ertapenem. So that's IV only. But you can get ertapenem at home if we've got all the other tests done and we haven't found anything. But 2 weeks at a minimum. Could be longer if we find something. Right?
So does that mean I'm here for 2 weeks minimum?
Not necessarily. No, we just need to get all the tests done. And then once all the tests are done, we can finalize the plan for the antibiotics. Longer term, once you've had an episode of SBP, the bacterial infection inside the ascites, we give you indefinite antibiotic prophylaxis. So a pill once a day to prevent recurrent infection of the ascites. Forever.
Yeah, because so usually I do a drain every 2 weeks with Dr. Aldabad. So I always ask him about antibiotics. He said, no, don't worry about it.
Yeah, they don't do prophylaxis until you get an infection, and then once you have one infection, we try to prevent another one.
Okay.
So after the ertapenem is done, we'll want to switch you to ciprofloxacin. And that'll just kind of continue forever.
Sure.
Okay?
Yeah.
The other thing that I am mindful of is you're on fairly high doses of steroids for a long time, and we're not sure when or if you'll be able to titrate down low enough to be at less risk of certain infections.
Right.
So when you have 20 milligrams of prednisone a day for more than about 4 weeks, there is a theoretical risk of a lung infection called pneumocystis. And so we consider giving people in that situation an antibiotic, Septra, so that sulfa drug that can cause Stevens-Johnson. We consider giving a low dose of Septra to prevent this pneumocystis infection in the lungs.
Okay.
You've got a lot going on.
Special case.
They're trying to get off the prednisone as much as possible. You're not on a lot of immune suppression in the way that we would worry about, and you don't have your underlying diagnosis of Crohn's and rheumatoid arthritis, psoriatic arthritis, aren't particularly high risk for pneumocystis, but it is something to consider. I don't want to add something right now, but it is something to consider in the medium to long term, especially if you end up staying on steroids,
indefinitely.
Okay. So I'll write that in my note. We don't need to do anything about it now. You're already going to be on the prophylactic antibiotic for the ascites.
Yeah, see my general doctor, Dr. Kaufman, he said like coming down from 25 milligram of prednisone down to like 10 is easy. But coming down from like 10 to 7 is devastating, that little bit when you get near the end there. He said it gets like exponentially worse. So.
Yeah. But for right now, you've got a bloodstream infection. You're on the right antibiotic. And we're going to do at least 2 weeks of that antibiotic for the infection. Okay?
The bloodstream is like really serious.
It just suggests that you've got a severe infection somewhere. In this case, presumably from the cellulitis. But it's also found in the acidic fluid. So it presumably spread through the blood to the ascites as well.
Okay. Alright. So, what else do we...
That's it for me. So, ertapenem, ultrasound of the right ankle, MRI of the spine, and then we make a decision about the transesophageal echo based on those. and then we make a plan for the antibiotics.
Okay.
Okay?
Yep.
Any questions for me?
That's it. I just wanted to ask about the Stevens Johnson's thing,
Yeah.
and is Dr. Ali here today?
Yeah,
Do you know if
he's
he's
around.
coming around to see me? I don't know.
I saw him in the hall, so
Okay.
I
don't
don't
know
know.
if he's
I don't
planning-
know which direction he's going.
Yeah,
but
I
if
don't
you
know
haven't
if
seen
he's.
him today,
I
then
don't know if he planned on seeing me or not. I just wondered.
I think he usually sees everyone every day.
Yeah.
So.
Okay.
Yeah.
I think that's all I got. I'll probably
Okay.
remember something as soon as you leave, but
That's how it goes.
yeah. Yeah, that's it, I guess.
Okay.
Thank you so much.
You're
It's a
welcome.
lot of information. That's all I needed to record it.
Yeah, that's fair. All right.
You don't mind if I use that
That's
for
okay.
something? I
Yeah.
won't put your name on it or anything.
Yeah, I appreciate that. Yeah.
Okay.
But I don't. Yeah, I don't mind if you post the information to
Yeah.
discuss with whomever you want, including Reddit. Right? It's your own medical information,
Yeah.
so you can do with it what you will.
Yeah. It's not like anything stupid Reddit. It's like medical information, educational part of Reddit. So
Yeah. Yeah. No, I'm not. I try to stay off Reddit as much as possible now because
it's
I get drawn in too much.
It's a rabbit hole. Yeah. I
It
know.
is. It is.
I had a big problem with it a while ago, but now I'm just using it just to document. Like I made a separate account just
Yeah.
to document this stuff, so I have a timeline
Yeah.
and stuff like that to keep everything organized. The
Nice.
doctor said this day, that day, and then some people just started following me and they're interested in the story. So
Yeah. It's good.
all right,
All right.
okay, thank you
Bye.
so much.
You're welcome.
Appreciate it. Have a great night.
You too.
Okay.
Yeah, so with Stevens Johnson's